Doc, what's your views on application of ozone in dentistry?
Well, I think it's required. I tell my patients that we use it for everything. It really does the heavy lifting, is what I call it. Ozone is a signaling molecule in the body when it's used in blood, so it's a good way to turn on the immune system. When we use it in BioDentist, I have the luxury of having an integrated clinic called BioVital that works in conjunction with the dental experience. So we do medical here as well as dental and combine the two, which is very powerful. Ozone gas, like I said, is a signaling mechanism for the immune system, but it's also a very powerful oxidant, so it has purification properties for the blood. Part of the BioDentist protocol is to use it in that manner and prepare the immune system for a patient that's pre-surgically, for someone who's going to go into having jawbone surgery, like anything related to periodontal disease or removal of dead teeth, which like root canals removal, and when we go in and clean out old cavitation sites where, say for instance, the wisdom teeth were removed. We use ozonated water during all these surgeries so that we can get a localized purification of the extraction site or the wound in the bone. I also use ozone for all the cavities that we, all the restorative dentistry. I would say underneath every single filling that we place, we use ozonated water. It's a very, very good it's a very good methodology when applied to dentin. So for drilling deep into a tooth, say if there's a real deep cavity, ozonated water has a hydration effect on the tooth, as well as purifying the dental tubules, which I have noticed over the years is very effective at reducing post-operative sensitivity. Whereas typically dentists are trained to use glutaraldehyde, which we use in some cases, but I think ozone's much more important and much less toxic. So restorative dentistry, say for instance, right before we cement a crown, again, we disinfect the tooth structure before we cement the crown. That seems to really help with, like I said, post-operative sensitivity. And then we no longer have hygiene, but when we had a hygienist at BioDentist, and I know that biological hygienists, they use ozone in their practices as an irrigant. I think it's really important to use that when getting your teeth cleaned as well. So, and a lot of my patients have their own ozone machines. There's ones you can buy over the counter. There's one that's it's a $70 machine. It's really helpful to for patients who have had just had surgeries and they have wounds that are closing, or people that have just bleeding gums or bad breath. I think this is really important to have the ability to make ozone water at home that you can use to brush your teeth and to use as a mouth rinse. So the use for ozone is just on and on and on. So yeah, I think but that gives Dr. Desai some input on how ozone can be used in his practice, and I'd strongly encourage you to get an ozone machine and to get some training in ozone. We do trainings here on ozone. Yeah, so good question.